Did you know that addressing hearing loss can make you functionally younger by close to 3 years? And it's not just about hearing, it's keeping your brain sharp and your social life happy. I'm Dr. Amy Friday. I'm a clinical psychologist and I've worked with people for the last 20 years on keeping their brain sharp and increasing their quality of life. I talk to people about lots of different things they can do, and their hearing is one of them. So here's the quick fact. Hearing loss is a risk factor for cognitive decline or dementia, for social problems, and even brain atrophy. But the good news is that there's something you can do about it. I'm going to tell you today, and it's not as simple or ridiculous as, well, go get your hearing checked. I'm going to talk about the real reason that people don't address their hearing loss and what you can do about it. So let's get to it. So who cares? So maybe I have a little bit of hearing loss. It's not a big deal, and everybody just mumbles anyway. Researchers from Johns Hopkins University have shown that hearing loss is an independent risk factor for dementia, all by itself. They did a study following over 600 people, almost 12 years. And what they found was that mild hearing loss doubles your risk for dementia, moderate hearing loss triples it, and if you have severe hearing loss, it makes your risk of dementia 5 times higher. That's crazy. They think this happens because of a couple of different things. One is cognitive load. So your brain just has to work so much harder to understand information because it's already working hard to just hear it and figure out what the heck people actually said or what the information is. So it is stressing your brain in addition to having to remember information or do something with it. They also see brain atrophy in your areas that are related to hearing loss. So you're being, in some ways, almost undernourishing your brain because you're not giving it the right stimulation from hearing everything. They also think it's because people have social problems. They become more socially isolated, they have more social conflict, and that's bad for brain health. But when you get your hearing fixed, those risk factors for dementia go down. Fine, I don't want dementia, but that seems so far away anyways, whatever. Well, if that's the argument, there's another more immediate issue that's causing you problems. When people are talking to you and you don't hear them, it causes problems in your relationships. We all know how this goes. So you're talking maybe to your partner, maybe to your spouse, and they're talking away, and you don't really hear what they're saying. Blah, 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 blah. They're saying something important, but you don't really get it, right? And then they look at you and ask what you think, or they ask a specific question. And instead of telling them that you actually didn't hear what they said, which might be kind of embarrassing, you pretend like you heard them. And so you try to stay kind of general, and you're like, oh, and you make something up, and you kind of throw it out there hoping for the best. And then there's their look. And it might be kind of confusion or frustration or disappointment because they think you're not listening, they think you don't care. There's something wrong with the interaction and they know it, but they don't know the reality that you just didn't hear what they said. It's horrible. Research actually shows that for the person who has hearing loss, their partner suffers even more. This was especially prominent for couples where the man had hearing loss and their partner was a woman, and that she showed problems in, let's see what they said, physical, psychological, and social domains. The person who doesn't have the hearing problem suffers because of hearing loss. And when the hearing loss is fixed, those problems can go away again. You can relate better. This is an immediate issue. So why don't people address their hearing loss? It's not like most people don't know where to go to get a hearing test. So yes, there's one issue that some people don't have insurance that would cover the test, or that hearing aids are really expensive and they can't afford them. That is a real problem. But for many people, that's not the problem. They could use their insurance and go get their hearing checked, and they could afford to get hearing aids, but they don't. Why? Well, there's a couple of important reasons. The first one is that talking about your hearing loss and doing something about it feels negative. It's kind of like the conversations you have where you're like, oh, what do you want to have happen when you die? And making plans for funerals and your will and so on. That's a downer. Nobody wants to be talking about that. It's not sexy or fun. So what do you do with this? Well, you could choose to think for yourself or help your loved one who seems resistant to this idea. Help them think about the positive spin on the issue. When you address hearing loss, what do you gain? You're gaining a better brain, mental clarity, staying sharp. You're also gaining better relationships, less conflict, less disconnection. You're also gaining energy and vitality. Because believe it or not, when you can't hear something, it's draining. I had a patient who talked at length about how exhausted she was every time she was with family members and conversations, or even when she went to her book club and she was like, what's wrong with me? Am I not able to think about the books? Is this too hard for me nowadays? Am I too old? None of that was true. She had a mild hearing problem. And so this idea of straining and trying to hear something when you can't really hear it, listening fatigue, that idea is real and it's exhausting for people. When you address the issue, you solve the problem. Presto, more energy. All these things are fantastic. Now the second reason, and I think the reason that most people don't address their hearing loss, is the emotion related to it. It's not because they don't know what to do, it's because of how it feels. Thinking about hearing loss means that we're old. What will people think? I don't want to deal with that. Hearing aids are such a pain. I don't want to deal with the whole issue and I'm not old. I don't want to look old. I don't want to be old. If I ignore this problem, I think I'm younger. But the reality is that ignoring your hearing problem is actually making you age faster, physically and mentally. If you fix your hearing issue, you can regain almost 3 years of your functional life and quality of life. That's huge. So start recognizing it. Do you notice that maybe you're not hearing everything, or it's just getting a little bit harder to hear things? You turn up the TV and you're like, nah, not that big a deal. I don't have time to deal with that. I'll think about it later. That's not just, oh, it's not a big deal. I'll think about it later. I'm busy. That's an emotional barrier. It's common and it's fine. So instead of seeing the problem of hearing and hearing aids and all the stuff that you might do about it as an old person's problem, let's start thinking about it as something that keeps us young. It reduces the problems that we have with aging. It keeps us functionally better. So how can you do that? Well, let's start with step 1. Reframe the narrative. Let's start challenging the thought that hearing loss is a weakness. Think of addressing it as an act of self-care. You're doing this to preserve your independence, to preserve your brain and do something great for yourself. It's like a massage. Step 2, start small. You don't have to make any big decisions today. Go get your hearing checked. Sometimes they're free at Costco or other hearing clinics, free hearing checks. They're available to you. Take a first step and just see. Maybe you don't even have a problem. But if you do, you get more information. You get choices. Step number 3, find role models. Look around you for people that you like or you admire who are actually wearing hearing aids and they're doing great. Heck, Bill Clinton started wearing hearing aids when he was 51 years old. Halle Berry and Jodie Foster are rocking hearing aids and doing awesome. And let's focus on the benefits. What do you stand to gain? A better brain, clearer conversations, more energy, more closeness in your social relationships. Is there any downside to this? So overall, hearing issues don't have to be a barrier to having a great brain and living a great life. It's really about what you can do to stay functionally young and give your brain a boost at the same time. So what can you do? Schedule a hearing test today or share this video with someone who needs to hear it. Did you catch what I did there? If this was useful to you and you want more information like this, feel free to join our This Beautiful Brain community, where every Sunday I send out a free newsletter where I give you other ideas on functional health. How do we stay younger and more functional in how we feel and how we act, not just how we look. It comes out every Sunday and I pour my heart and soul into it. And if you like these kinds of videos, check out more of them, where I tell you more about this idea of functional age and how we can rewind it, reducing years from our biological age and how our brain works, how we feel, and how we function. Can't wait to see you there. Bye.